Hi, my name is Jess Kostos. I'm a women's health physiotherapist and Pilates instructor. I'm also known as the Mama Physio and co-founder of the Pilates lifestyle. So I specialise in everything pre and postnatal, whether that's pelvic floor related or Pilates as well. I've treated over 1,000, maybe 2,000 pregnant women in my career. Mostly, I've worked on a maternity ward, but also in clinic as well. I've been specialising in pregnancy and postpartum for the last 7 years. I see lots of postpartum women for postnatal checks, but also for things like diastasis recti, so stomach muscle separation, anything pelvic floor, and pain as well. So when I see someone postnatal, I'm usually doing a check and I'm looking at their stomach muscles, I'm looking at their pelvic floor, and I'm looking at their back and their stability. So the things I'll generally see the most are prolapse, pelvic floor weakness, and stomach muscle separation. I'd say the thing that bothers women the most is generally the stomach muscle separation. The three most important things that I would recommend postnatal are, firstly, making sure you're getting enough rest. Really use that 6 weeks as an opportunity to accept as much help as possible. Secondly, book in your postnatal check with a women's health physio. I think it's really important and to have that comprehensive check. And third, getting yourself a pair of postnatal compression garment that's going to help you from day one postnatal right through past that 6-week point. So wearing postnatal compression garments will help because they'll act as your core muscles. They'll act like a corset around here, providing that support around your stomach, acting as your core when especially it is quite weak postnatal. So it will help prevent and manage any back pain. It'll also help with recovery of the abdominal muscles and also help support the pelvic floor muscles as well, especially if there's been any trauma there. For those who've had cesareans, it's actually really nice to have some support over the front as well and can help reduce that swelling and any discomfort. So when I'm recommending postnatal recovery garments, the first thing I want is something that's going to give paneling and support around through the abdominal region and also potentially around the pelvic floor region as well, just to help with that support and recovery. I'll also look for something that looks nice and is appealing and you can wear it outside, something that you can wear inside while you're feeding and caring for your baby, but you can also pop to the shops and be wearing something that looks stylish as well. I'll also look for something that's, it's affordable. Normally you'll need to own a few pairs. You might get baby poo, wee, food, anything on it. So, you do need to have a few pairs, one in the wash, one that you're wearing as well. So I like to recommend these postnatal, firstly, to help with your stomach muscle separation, with the healing there. We know that everyone gets a tummy muscle separation when they're pregnant, but we want to make sure that that actually has the time to recover, especially in the first 6 weeks. That's most important. It will also help with any swelling and discomfort around through the area, more important with someone who's had a cesarean. Also underneath in the crutch if you've had any stitches through there. It's also great as well for those who have any back pain or pelvic girdle pain, just because it gives that support around through that area and acts like that corset of muscles as well. So I absolutely love the Emamaco leggings. These here, I'm also wearing it as well. Because they're stylish, they look good, I love them, but my patients come in and they rave about it too. So I want to be recommending something that my patients love and wear as well. Depends how the delivery went, but generally speaking, you can wear the leggings from a few days after giving birth. If someone's had a straightforward vaginal delivery, then you might be able to wear it the day after you deliver, depending on how fast that tummy goes down. For those who've had a cesarean, it might take a little bit longer to fit into them, so I generally allow maybe up to 5 days before you put them on. But when you first wear them, they should feel really nice and supportive and comfortable. They shouldn't feel like they're giving you reflux or cutting in anywhere in particular. They should feel really nice, even pressure around through here, nice pressure across through the scar if you've had one as well. And also nice across the legs, really fit around and snug around the crutch as well. So the leggings are safe to wear after a cesarean. I actually do recommend them routinely after a cesarean just because it feels so nice having that compression over here. As a physio who's worked in a hospital, if anyone has any type of abdominal surgery, you're always recommending compression and support across here, especially if someone needs to move or cough or lift their baby, for example. So I would highly recommend it, and even if it's not a cesarean, even if someone's had gynecological surgery, I would recommend them as well. You can wear the leggings 24/7, you can wear them throughout the day, and you can also wear them at night. Women like to wear them at night because sometimes, especially if you've had a cesarean, lying on your side, that dragging sensation of the stomach on the stitches isn't that comfortable. So the fabric here is breathable and it has the wicking inside, which helps make it breathable and stops getting any dampness against the skin. So you can wear it throughout the day and you can wear it at night as well. So in the first 6 weeks after having your baby, I'd say the first thing is to start your pelvic floor exercises. Normally you'll have to wait till you've done your first wee. As a guide, I would say in the first week you can generally hold your pelvic floor for 1 second, and the second week 2 seconds, 3 weeks in the third week, and so forth. You might be able to hold for a little bit longer, that's great. Also making sure you're focusing on the relaxation part as well, that's just as important as contracting. Generally, you can start to do some really gentle lower stomach muscle exercises unless you've been advised against that. So let's just say Pilates, and I say Pilates just because I love that and I do recommend that postnatal, but you can do some really gentle postnatal exercises like your single leg lifts, your knee fall out, any upper limb movements as well. I'm generally fine with patients doing, functional movements like squats, lunges, things like that, because you're going to be doing it anyway. So you're better off training yourself to do it properly, and gentle little upper limb weights as well, no more than the weight of your baby if you really need to do something as well. So for walking, don't push yourself too much too soon. Generally, I would expect that in the first week, you could probably tolerate 5 to 10 minutes. At 6 weeks is the point when you could probably tolerate about 30 minutes, okay? So really don't push yourself too soon. The risk being that if you push yourself too soon, you may you might get pain, especially through the front here, or you may develop a prolapse as well. So really slow down, rest as much as possible. So my patients love Emamaco purely because, the pregnancy leggings, which I'm not wearing, but they grow with you throughout your whole pregnancy. So, I've tried on a pair and that was flat on my stomach, and I've seen patients come in at 42 weeks pregnancy and they're still wearing the exact same pair. They come with and without pockets. I think people tend to be on team pockets or no pockets. I love my pockets. And they've also got some really nice colors as well, so you can have that variety. And they also have a non-pregnancy range, which is what I'm wearing right now, which is a really nice snug fit through here, and a nice crop top underneath, which I love wearing for my Pilates class. It's just really comfortable. The other thing is they do not pick up any lint, which is important because I'm always lying on the mat and on the ground, and with pets and things like that, it's not sticking onto me, which is important. I'm also known as the Mama Physio, so this is my personal branding. I work for myself a couple of days a week in Melbourne. I see everything women's health, from prenatal, postnatal, menopausal women, sexual pain as well. I tend to see, men as well and children, just because they're family members of the women that I'll see. I developed an online Pilates program called the Pilates Lifestyle with a friend, Kat, last year. We're both Pilates instructors as well, and during lockdown we just found we had so many patients contacting us looking for something to do to continue to have that continuity of care during that period. So we spent a lot of time, a lot longer than what I thought it would take, developing an online program, which is exactly what I would give my patients who come to me for appointments. But it's affordable. We have a prenatal program which goes the whole way through your pregnancy and connects through to a postnatal program right through to 12 weeks postpartum, and longer past that through into fitness as well. So we've kind of tried to encapsulate the whole way through the lifespan as a mum for something that's safe. We also have educational videos there. As a physio, I've put in lots of educational videos on the pelvic floor, tummy muscles, prolapse, exercise in pregnancy. Kat's a nutritionist, so she's given lots of pre and postnatal nutritional advice as well. If you'd like to find out anything else about the Emamaco maternity range or me as a physio, any questions or advice, feel free to get in touch. You can get in touch via my website, www.themamaphysio.com.au, or through my Instagram, that.mama.physio, or have a look at my online Pilates program, thepilateslifestyle.co.